I myself, Jeevan Pratishta Rajvanshi, working as an assistant professor in Jyoti Vidyapeeth Women's University in the Department of Faculty of Physiotherapy and Diagnostics. It is Jyoti Vidyapeeth Women's University is the first state women's university in the Rajasthan, and it is 35 kilometers outer than the Jaipur. Now, in last topic we have discussed about the accommodation. What is accommodation? What are its mechanism? What are its theory and the presbyopia? How the presbyopia is caused? Presbyopia is an anomaly or condition. What are the symptoms? What are the treatments? And so. Today we will discuss about the anomalies of accommodation. Anomalies means any disorder due to accommodation. So, have you read about any anomalies about the accommodation? No. Then I will tell about the anomalies of accommodation. Presbyopia is not an anomaly of accommodation. It is a condition of accommodation. It is a condition, not an anomaly of accommodation. So we will here to learn about the anomalies. First anomaly is the insufficiency of accommodation. Second is sustained accommodation. Third, inertia of accommodation. Fourth, paralysis of accommodation. Fifth, excessive of accommodation. Sixth, spasm of accommodation. And seventh is the last but not the least is the accommodative esotropia. So you have read in last topic about the presbyopia causes, premature presbyopia symptoms, and you haven't read, I think, the optical treatment of the presbyopia. So listen about the optical treatment of the presbyopia. Firstly, it is a prescription of appropriate convex glass for the near world, a rough guide for guiding the presbyopic glass in an emetrope can be made for patient's age. So for 40 to 45 years of age, plus 1 diopter is required. For 45 to 50 years of age, only 1.5 diopter is required. 50 to 55 years of age, 2 diopter is required, and 55 to 60 only 2.5 diopter is required. What are the basic principles of presbyopic correction? First one is the refractive error for distance is corrected first. Correction needed in each eye should be tested separately and added to it. Distant correction means monocular vision you have to do. Near point should be fixed according to the profession of the patient. Weakest convex lens with which one can see clearly at near point should be prescribed over. Correction will also result in astronomic symptoms. Presbyopic spectacles may be unifocal, bifocal, and or varifocal or multifocal. Okay. What are the surgical treatment for presbyopia? That is the corneal procedure, that is monovision LASIK, laser thermal keratoplasty, laser based corneal procedure, presbyopic, bifocal LASIK, presbyopic, multifocal LASIK, and laser thermal keratoplasty. Now The second treatment is surgical treatment is intraocular refractive procedure. That is the refractive lens exchange, fake refractive lens, monovision with IOLs, and scleral based procedures. Anterior sclerotomy, scleral spacing procedures, scleral ablation with erbium, YAG laser. Okay, YAG laser is also used. Now, we will discuss about the anomalies of accommodation. First one is the insufficiency of accommodation. Insufficiency means the patient is unable to accommodate how much he should accommodate for seeing an object. Okay. Condition in which accommodative power is constantly less than lower limit of normal range according to patient's age. Etiology: premature sclerosis of lens, weakness of ciliary muscles due to systemic process, weakness of ciliary muscle due to local causes. Okay. Now, what are the clinical features? Clinical features mean what you should see in the patient of insufficiency accommodation. That is, near work is blurred, become difficult or impossible, disturbances of convergence, it is stable condition, and features of eye strain and asthenosphia, headache, fatigue, and irritability of the eye while attempting near work. Now, but is not stable in association with ciliary muscle weakening. This is non-associated. These all clinical features are not associated with the ciliary muscle weakening. Okay. Then we will come to know about the treatment of accommodation, insufficiency accommodation. Then what? Identification of the treatment of any systemic cause and any refractive error should be corrected, and if vision for near work is seriously blurred. If the vision for near work is seriously blurred, then obviously the patient will use the specs. That is, he or she may be presbyopic or may be insufficiency of accommodation. If the patient is insufficient for accommodation, then the patient will obviously use the glasses or any exercise or any different therapy. Convergence insufficiency is there, then piece in prism can be added. Prismatic correction added should bring near point of convergence to same distance as near point of accommodation. Weakest convex lens should be prescribed so as to exercise or stimulate accommodation. After recovery, addition correction should be made weaker and weaker from time to time. Accommodation exercises also, we should do the exercises also which are related to the accommodation. Okay, like the push-up exercise, accommodative exercises, or the flippers should be done simultaneously in both the eye. Even in both the eye, you should have to done in the both eye, because the insufficiency is the anomaly of accommodation which affects both the eye, not the single eye. And in presbyopia also, both eyes are affected, not the single eye is affected. Okay. Accommodation test card exercise and useless in generalized diabetic and sclerosis of lens should be done simultaneously in both eye, even if associated with convergence insufficiency. And while doing exercises, patient should wear correction for for the distance. If the patient is having any correction for the distance, then the patient should wear that correction also for doing the exercises or the therapy. And weakest convex lenses should be prescribed to the patient for the exercises and the accommodation. Weakest means lowest. After recovery, additional correction should be made weaker and weaker for time to time. Okay, have you understand the insufficiency of accommodation? Now, second one we will discuss. Okay, ill-sustained accommodation. What is ill-sustained accommodation? Ill-sustained accommodation means the patient is able to accommodate the eye, but that accommodation is not sustained. That is not sustainable. That accommodation is only for seconds, but the patient need for a minute that accommodation. That is known as the ill-sustained accommodation. Now we will study the accommodation fatigue. You can see the accommodation fatigue also. It is a situation in which the range of accommodation is in normal range, but it cannot sustain it for a sufficient period of time. Initial stage of insufficiency of accommodation, it occurs due to stage of convalescence from debilitating illness, stage of generalized tiredness when the patient is relaxed in the bed. Okay, what are the clinical features for ill-sustained accommodation? You can use your mind and you can write the symptoms. Most of the symptoms are same as the insufficiency accommodation. That is the blurring of near vision after the prolonged near work, headache, asthenopic symptoms, eye ache, fatigueness, sleepiness, loss of comparison with continued reading, a dull pulling sensation around the eye. Then what treatment will you give to the patient which is ill-sustained of accommodation? The treatment which we can give to the ill-sustained accommodation is the debilitating the illness. General tonic measures should be taken. The condition of illumination and posture while doing near work should be improved. If the patient is doing his or her near work with too much closeness, then we should improve his or her near work distance, posture, and general tonic measures should be taken out, and we can give the exercises also to sustain his or her accommodation for a period of time. Okay, now today we have discussed about the two accommodation and the third one also, inertia of accommodation. Okay, it is a condition in which the patient faces difficulty in altering the range of accommodation. Range of accommodation means if the patient is seeing for the near and he want to see the distant object, then he or she feels difficulty in changing the accommodation, altering the range of accommodation. If he is seeing to distance, then if he want to see the near, then he or she will feel some difficulty in inertia of accommodation. Then the amplitude of accommodation is always normal. Amplitude to make use of ability to make use of amplitude quickly and for long period of time is inadequate. In this, the patient is having the problem in altering the range of accommodation, not anything else. Accommodation, the patient is doing the accommodation very well. He is not having any problem, but the symptoms are same as that of the two: blurring of vision, difficulty in sustaining the near task, fatigue, headache, eye strain, this and that. And the treatment is correcting the refractive error and accommodative service exercise. These are the treatments for accommodation, inertia of accommodation. 3 we have discussed. Next 3 will be discussed in the next lecture. That's all for today. Revise and have a read on the lecture. If you are feeling any problem, any query, then comment in comment box. Thank you बेटा. नमस्ते बेटा, खुश रहिए आप लोग.